partner with the Doula Foundation to bring some helpful tips for you and your family. If you have any suggestions about topics that you would like to hear more about, please put them in the comments and we'll consider them for our next class. Today's topic is on your baby's belly and maybe some natural ways to help calm their belly down or to give you some tips or some tricks to help them feel better. My specialty in the office is pediatrics and pregnancy. I see a lot of big bellies and a lot of little babies, and so that's kind of where my passion is with chiropractic. I think that people think about chiropractic mostly as pain control, but really chiropractic is about helping your body function better on its own. So chiropractic can help a lot with babies, and I see a lot of baby digestive issues in my office. Part of figuring out what's going on with a baby or figuring out how to help them is to kind of solve their puzzle. They present with all of these different symptoms or the different things that they do, and then you have to use all of the clues that they're giving you to try to figure out what's wrong with them and how to help them. So it can sometimes be a challenge. I often say that I wish that they came with a little digital printout on their forehead so you would know why they're crying or why they're upset. So I'm going to kind of walk you through some of the different symptoms that they have so you can understand what normal is or maybe when to become more concerned, and helping to decipher the clues that they give you to figure out what's going on with them or how you can help them. A lot of times you try 2 or 3 different things and figure out what's working for them. So I get a lot of parents in that have a crying or a fussy baby and they don't know what normal is and what abnormal is. When you have a baby, the only way that that baby is able to communicate with you is through crying. So they cry when they feel insecure, they cry when they're tired, they cry when their tummies hurt, they cry when their backs hurt, they cry when they're bored. And so it's normal for your baby to cry, but when it becomes abnormal is when you're not able to console them, or when they cry for a long period of time and you have tried just about everything. So normal would be crying several times throughout the day, but you're able to get that crying under control in about 15 or 20 minutes. Abnormal crying, or the definition of colic, is crying for 2 or more hours a day, and that cry is usually kind of a high-pitched cry. They will be red-faced, and when babies are uncomfortable, they extend. So they extend their back or they extend their head. They become really, really rigid. That would be more of an abnormal cry or a painful cry. They don't really tell you why they're painful, but most of the time it's because they're having some sort of digestive discomfort. I also have a lot of parents that come into me thinking that there is something wrong with their baby because their baby is gassy. And gassiness can be normal. What is abnormal is for them to cry for hours a day with the gassiness, or having a hard time burping them, or having a hard time getting them to pass gas. With adults, gas is normal. It's a part of digestion. So when you eat, your digestive enzymes will start to break down that food, and then a byproduct of that is gas. That food kind of ferments in there. The good enzymes break it down, the good bacteria break it down, and the side effect is gas. With babies, their digestive system is immature, and so it doesn't move that gas very well. Or when they need to burp, they don't necessarily know how to get that burp out. So if you've watched a baby and they move and they wiggle their little arms and they move and they wiggle their little legs, the reason that they're doing that is because they're figuring out how their muscles move. Same thing has to happen with their digestive system. They aren't born with the knowledge or the know-how to be able to fart or to be able to get that gas out. So a lot of times we have to help them with that. So gassiness is normal. Adults fart up to 23, 26 times a day. Babies do too. So just know that if your baby farts a lot, it's probably pretty normal. What's abnormal is when they scream and fuss and cry for long periods of time because they're not able to get the gas out. Bowel movements. In newborn babies, in your infant, it is normal for them to have a bowel movement several times a day. Usually it is after every feeding, they will have a little bit of a bowel movement. When they get to be about 2 or 3 years of age, the bowel movements slow down a little bit. Your pediatrician will tell you that it is normal or can be normal for a baby to go up to 7 days without having a bowel movement. And in my experience, babies are really, really, really uncomfortable if they aren't going that often. And so to me, that's an indicator that there's a problem there. It is either a problem with their diet, it's a problem with their digestive system, it's a problem with them needing probiotics. And so I like babies to have a bowel movement once a day, at least once every other day. I think that they're much more comfortable, they're much less painful, and a lot less irritable if they're going more often. So if your baby is not going to the bathroom that often, then we probably should try a few different things to see if we can get more regular bowel movements for them. So the other thing that would be abnormal in your baby's bowel movement would be the color of their stool. I talked about how you kind of pick up on hints of things that are going on with baby. Looking at the color of your baby's stool can be a clue for you. In the links, I have put a link for this baby poop wheel. It is the color wheel of poops, and it tells you different things. Doesn't tell you exactly what's going on, but it can give you some clues. So normal baby poop is kind of this mustard yellow in color. It should not be mucousy or slimy. Should be a little bit seedy. If it's frothy or foamy or mucousy, that means that there's some sort of irritation going on in that digestive system, and we need to dig a little bit further to figure out what's going on there. And sometimes green poops. Green poops can be normal in a formula-fed baby. If they're not having a lot of irritability, green poop would be kind of normal, but green poop associated with a lot of irritability or red face, crying, can be an indicator that there is an allergy to cow's milk. Either cow's milk in the baby's formula or cow's milk that's being passed through mom's breast milk. So take a look at this poop wheel, and if your baby has anything other than this mustard yellow poop and a lot of irritability, check this wheel and it may be able to give you some clues as to what's going on there. Let's see. Breastfeeding. So normal breastfeeding. In newborns, babies nurse about every hour and a half to every 2 hours. A normal breastfeeding session should last about 20 minutes. If the breastfeeding session is going on for a long period of time and the baby is actively nursing, not just nursing for comfort, then that could be an indication that mom's supply is low or that the baby's latch is a little bit weak and it's taking them a long time to be able to breastfeed. Breastfeeding should not necessarily be painful. Sometimes there's some discomfort in the beginning as the nursing starts to toughen up the skin a little bit, but cracking or bleeding of the nipples or misshapen nipples after the baby is feeding can be an indication that something's going on with the latch. If the latch isn't really good and the baby's making a really clicking sound or a gulping sound, or there's a lot of leaking from the sides of the mouth, either with breastfeeding or with bottle feeding, then that can be an indicator that something's going on with the latch. If the latch is not good, then the baby is swallowing too much air, and that could be causing a lot of gassiness. So if there is something going on with the latch, then reach out to your local resources, reach out to your lactation consultant, reach out to the baby's pediatrician, reach out to me. There's a great Facebook group called the Missouri Tongue Tie group. So that can be that either the baby needs some suck training, and lactation consultants are really good at being able to identify those issues, or it can be that the baby has a tongue tie or a lip tie, and releasing that tongue tie will help them be able to move their tongue better, to be able to latch better, to not swallow as much air. So if there's something that doesn't seem right in breastfeeding or bottle feeding, then reach out to those local resources. Normal versus abnormal spitting up. Babies spit up. I talked about the digestive system being a little bit immature. So the sphincters are what close the stomach to prevent the backflow of milk. In infant babies, their digestive system, again, the muscles are learning how to push the food from the top of the digestive system down through the bottom of the digestive system. And sometimes it isn't really effective. And so those sphincters either won't close all the way, or the stomach contracts and the food comes back up. So spitting up is normal in a newborn baby. What would be abnormal is if they are projectile vomiting, if they are consistently spitting up most of their feeding. If the spit up happens 45 minutes after a feeding every time and the milk or the spit up is kind of chunky or fermented. When the spit up happens much later, that is an indicator to me that they're not digesting their food really well. So one of the things that we would look at is the diet. The baby's diet is either formula or it is mom's breast milk. Is there something in their diet that they're not processing really well? The other thing that I would look at is whether there was something that happened in and around the birth process that could have damaged their good gut flora or their good gut bacteria. Sometimes moms are put on antibiotics during the birth process because they have group B strep. Sometimes moms are put on antibiotics during the birth process because it's a longer labor or they're showing signs of having an infection. Antibiotics that are given to mom during the birth process can affect the baby. Part of that whole birth process is for the baby to pick up good bacteria to be able to colonate their gut. That helps us fight off infection, but it also helps us digest our food really well. And when antibiotics are given, then they don't have that good bacteria. So sometimes we need to supplement with a good infant probiotic. Probiotics for adults and probiotics for babies, the same strains of bacteria are there, they're just in different quantities. So it's really important to give your baby a probiotic that is specific for infants. And if it is a probiotic that they need, then we have some great natural food groceries around here that are great places to get an infant probiotic. Most infant probiotics are actually in liquid form, so you can do them by dropper. We sell them here in our office. Mama Jean's is a great source of that also. And then we're talking about mom's diet. So well, let's start with formula. Let's just start with formula. In the United States, most commercial formula is a cow's milk formula. So all of the Similacs and the Enfamils, they're all based on cow's milk. The only ones that don't come from cow's milk in the United States are soy formulas. Not a big fan of soy formulas just because they're a phytoestrogen. They can kind of act like an estrogen in the body. But so the other choice is the Enfamil and the Alimentum. All of those are based on cow's milk, and cow's milk is actually pretty difficult for our human bodies to digest. Cow's milk is, it affects mucous membranes, so a lot of times it can cause irritation in the gut lining, and that's where we sometimes get some of the mucousy poops or the constipation issues. So if your baby is really uncomfortable and red-faced and screaming and they're formula fed, then it may be an issue with that formula. They're just not digesting it really well. So what do? If you can't do cow's milk formula, and that's the only thing that we have in the United States, what do? You can order a goat's milk formula from European countries. They have some great brands that are organic and they come from Europe. Holly is a brand, H-O-L-L-E, and HIP, H-I-P-P. Used to be that you had to wait for them to be shipped from Europe, but now we have some American distributors that are actually shipped from the United States. You can get them in within a couple of days. Those are a great option. Cow's milk formula cow's milk is kind of hard for the human body to digest. A lot of people are allergic to it. It affects mucous membranes. Goat's milk can do that, but goat's milk is more like human milk in structure than cow's milk is. So a lot of babies that have a hard time digesting that cow's milk do much better on goat's milk. Cow's milk is also, the protein from cow's milk is passed through mom's breast milk. So it's usually not the lactose, which is the sugar, it's the casein, which is the protein that babies don't process really well. So if you have a breastfed baby that is colicky and irritable and having a hard time, then it could be the cow's milk that's being passed through mom's milk. There are some kind of common things that can be irritating to the baby that the baby doesn't digest well that are passed through mom's breast milk. I usually, if there's a problem with the baby and I'm seeing a lot of colicky behavior, I will eliminate cow's milk first from mom's diet. So they go in order of cow's milk, the next one would be gluten, the next one is corn, soy, and eggs. So I start with cow's milk and then move to the other ones if we haven't made much progress with cow's milk. Casein milk has to be eliminated from mom's diet for a period of 30 days to get that casein completely out of the system. So if you have eliminated cow's milk for a period of 30 days and you haven't noticed much of a difference, you can challenge by doing a big dose of dairy and seeing how the baby responds in the 24 hours after that big dose of dairy and see if that has anything. So then the next thing is there are some irritations or things that may not necessarily be an allergen, but they're foods that can pass through mom's breast milk that cause gas. And so this is another handout that is in a link. It's called the anti-colic diet. These foods that are on this side are foods that can commonly cause gas. The foods that are on this side are foods that are in mom's diet that are generally well received with breastfeeding. I never tell mom to completely eliminate these foods because these are healthy foods. But if you notice that your baby has been really, really irritable, take a look at this list and see if there's something that has happened in the diet within the previous 24 hours and see if there's any rhyme or reason to it. If you always notice that your baby is cranky after eating cucumbers, then hey, cucumbers on this list, it probably isn't something that your baby's processing really well. In my experience, the most common culprits are cruciferous vegetables, so cabbage, broccoli, Brussels sprouts. Those are cruciferous vegetables and those can make your baby really gassy. So you may not actually have an allergy to it or the baby may not be allergic to it, but they make them really gassy, so they make them really irritable, so that makes you really irritable. So have this list nearby, and if you notice that your baby's having a rotten day, take a look at the list and see if there's any commonalities there. So then you might be asking, what in the world do I do if I've looked at diet and I've looked at probiotics and I've looked at breastfeeding and my baby is cranky, and I'm having a hard time getting them to pass gas? I like to show you the digestive system. This is my baby for the day. This is Penguin. And I have printed out just kind of a map or the anatomy of the digestive system so you can understand why we do a massage in this way. So when you eat, the food goes into the mouth, down to the esophagus, and into the stomach. The stomach is right underneath the sternum, and it's just a little bit to the left side. The food drains from the stomach into the small intestine. And the small intestine is this tangled little spaghetti noodle in the middle. The small intestine is responsible for the absorption of most of your nutrients. So this is where most of the absorption happens. The small intestine then drains into the large intestine or the colon. And the colon is where most of the absorption of liquid happens. So the food, after it's kind of digested, goes into the large intestine and our body absorbs the water from it and actually makes it into the poop form. Where the small intestine and the large intestine come together is right down here in the lower right quadrant. It's called the ileocecal valve. The ileocecal valve is where small intestine meets the large intestine. And trivia fact for the day, it is also where the appendix is located. So this is all in the lower right quadrant. The large intestine goes up, over, down, and out. So when we do a massage, you're gonna massage the large intestine, and you're gonna go in the direction that the large intestine travels. The reason is that peristalsis is the contraction of the muscles of the intestine, and it's what moves the food or the poop through. Peristalsis normally happens about every 20 seconds, so every 20 seconds you'll have a contraction. And the goal of that contraction is to move the poop through. So we start the massage right down here where the large intestine starts. Sometimes if you look at Dr. Google or you do a Google search, it will tell you to do an ileocecal massage for your baby. And that's what it's talking about, just massaging this area, because that's where you want to start that happening. So the ileocecal valve is right inside the baby's hip, right on the lower right quadrant. That's where I start. I usually do a massage with 2 fingers, and I do it to the baby's tolerance. So if the baby is really irritable and really painful, their belly will be hard. When you touch it, they will fuss and they will cry at you. So I'm not able to push very hard when their bellies are really sore. But I'm gonna push just maybe 1/4 of an inch or 1/2 an inch in, and I'm gonna just do a gentle little circle with my fingers. And then I'm gonna come up and I'm gonna do a gentle little circle here. And I'm gonna do this all the way around this large intestine tract. Right lower quadrant, up, over underneath the sternum, down, and then out. So I usually work through this about 3 or 4 times, and I try to make it in about 20 to 30 seconds for a round. So basically you're going in a clockwise motion. So I like to get a good belly massage in, and then I like to do the leg bicycling and the leg pumps. It's hard to show you with Penguin because Penguin doesn't really have legs. But when you're doing this, you're gonna take your baby's legs and you're gonna kind of bicycle them back and forth. And then you can bring them up and tuck their knees into their tummy and extend them, and knees into the tummy and extend. And you can do that several times also. A lot of times that will help to get things going. They'll probably fuss and cry at you the whole time, but it'll help get things moving. You can, at that point, flip them over into tummy time and have them kind of come up on their knees so their butt is up in the air. We're going to use gravity as our best friend. Air comes to the top, and so a lot of times that will help them go ahead and get their toots out. In extreme circumstances, sometimes you can do a little bit of rectal stimulation. So taking the tip of a Q-tip and kind of just delicately touching the outside of the rectum. That will kind of get them to contract, and a lot of times they will poop or fart with that. There's also a handy dandy little tool. It's called a nose Frida. I'm sorry, the nose Frida is to get the boogers out. There's a device called the Windy Frida, and in a lack of a better way to describe it, it's kind of like a straw, and it is inserted into the rectum and it allows air to come out. So those are things that you can try in extreme circumstances. If you just have a fussy baby and you don't think that they're uncomfortable, but you're having a hard time getting them to sleep or to calm them down, getting into a good bedtime routine with them is awesome. You can do a warm bath accompanied with a massage. I don't usually recommend massage lotions that have smells or anything into them, so I usually recommend just a coconut oil as a great moisturizer and a great way to get a baby massage in. It's good for moms and dads to bond with the baby, and it helps get them calmed down. You can also try swaddle. So babies have this reflex called the startle reflex, and when you're trying to get them to calm down, a lot of times they will wake themselves up with the startle. So swaddling them keeps their arms and their legs in and keeps them from startling less. So sometimes even a warm swaddle is good. So put that swaddle in the dryer for about 5 minutes and then have them swaddled up and nice and warm like little burritos, and that can sometimes keep them really calm. Other things that you can try are some over-the-counter things. Gripe water is sometimes an option. With gripe water and gas drops, you're going to find that sometimes it works and sometimes it doesn't work, but it's fairly harmless. Gas drops work by breaking the walls to the gas bubbles, and that helps babies be able to burp a little bit easier. So gas drops sometimes work. And then gripe water works, it's usually with some great herbs. So fennel is one of the herbs. When you're looking at gripe water, make sure and use gripe waters that have all organic ingredients and don't have any of the chemicals or the dyes in them. Your baby doesn't need chemicals, your baby doesn't need dyes. So the gripe waters work by the herbs that they have in them. So try a good gripe water. Those are probably my best suggestion to helping with your baby. Chiropractic also helps with babies that are uncomfortable. Sometimes they're uncomfortable not because of their digestive issues, but because they need a good adjustment. Adjusting the mid-back helps normalize the nerves that feed the stomach and feed the large intestine. So a lot of times that will help them digest a little bit better. Or it can just help with any pain that they're having. So sometimes that extension is an indicator to me that they need an adjustment and that they're in pain and trying to relieve that pressure. So I hope that that helps you guys out some and gives you maybe some tips and some tools to try. Again, I wish babies were born with these little digital printouts that told us why they were crying or why they were fussy. But usually kind of systematically working through some of those things may give you some pointers or some tips to try. Again, we're going to do more classes with the Doula Foundation. We're excited to partner with them. I'm excited to partner with them. So if you have anything that you want to know more about, send it as a comment, and we definitely will take that in mind when we're doing our next class. Appreciate you guys. Have a good afternoon.